This is WCG Patient Radio. I'm Steve Smith from Patient Advocacy at WCG, a company that provides ethical treatment of the people who volunteer for clinical trials and related services that make those trials faster while keeping them safe. We're speaking today with Sarah Tompkins, the founder of the Ehlers-Danlos Syndrome patient advocacy group in the Pacific Northwest. She's here to tell us about that and about Ehlers-Danlos Syndrome and about some of the good things that patient advocacy does for people with this disorder and other rare disorders. Hi, Sarah. How are you?
Yes. Great. Thank you, Steve. So great to be speaking with you today.
When I met you recently, you were actually at a patient advocacy event in Washington, D.C. for an organization that gives patients a voice on Capitol Hill, the Every Life Foundation for Rare Disorders. And so I know that you're not only active in the Pacific Northwest, bringing together patient advocacy for many people out there, you're active nationwide, helping to set priorities and advocate for legislative change. So you're quite active. I also met, when you came into the event, your nice husband who you introduced to my friend Mark Dant, and you're really getting around and making a big difference. So let's talk about those things. Tell us about Ehlers-Danlos Syndrome that you have and that you're advocating for.
Well, thanks, Steve. Yes, Troy, my husband, as you mentioned, is a big part of why I'm able to advocate. Another reason is the privilege that I have of having such great health insurance. Using that advantage, I've been able to have many, many different medical treatments that enable me to travel and advocate, but I'm a very lucky person. Ehlers-Danlos Syndrome is a genetic connective tissue disease. So basically, at a cellular level, the collagen that I make is faulty. It's weak, it's stretchy. A good example is picturing a basket. Instead of having many woven threads, it has very little threads and is very weak and has a propensity for tearing and being frail. And because of this, it affects every system of the body, not just the joints, but the actual tissue. Being weaker means that you have issues with blood pressure, with heart, cardiac issues, literally every orthopedic issue you can find. So I have been very privileged to have had over 40 surgeries. And that is a blessing that I know that has enabled me to do such advocacy, but it also really gives me the propensity to advocate for other EDS people and people with connective tissue disease who have collagen issues that aren't able to get the care that I've been so lucky to get. It's very
40
hard to
surgeries.
Get into specialists. Yes.
Did you say
lucky.
40? 40?
Yes,
40?
That's correct. 40 surgeries and procedures. I have had over 5 hip procedures, stabilizations, and donor tissue added. I've had 6 shoulder stabilization surgeries, thumb, wrist, arm, elbow. Truly, I couldn't list all of them without going into my medical record, but I have.
So what would happen if you didn't have these surgeries? You mentioned, are these surgeries preventing something or yes?
So these surgeries are repairing something with the connective tissue disease. What happens is the collagen is so frail that we tend to injure our bodies much more easily. That includes people with hypermobility, for example, have a much greater range of motion. But with that greater range of motion can come also the ability for dislocation and subluxation. And we know that there are people who perform in Cirque du Soleil who are able to contort their bodies in really interesting and great ways and not have dislocations and subluxations. But unfortunately, it's very difficult to study that particular population for them to be able to continue being performers. They need insurance, and it's hard for them to be in a clinical trial and do a study while being performers in that. So we haven't been able to really make that connection of why body contortionists are able to do what they're able to do, but other people with the same issue with collagen and hypermobility are bedridden or unable to have mobility to stand or walk. For a long time,
you bring up a couple of interesting topics there. The the fact that there's a possibility of studying populations with Ehlers-Danlos syndrome from a genetic perspective and having differentiated genetic diagnosis, and the possibility of clinical trials. Is that right?
Exactly. And I think that that's something that I'm very proud of the Ehlers-Danlos Society doing the work that they have through the University of Illinois with their work into looking at the genetic cause of hypermobile EDS. But we know that there's a genetic EDS and there's also a hypermobile joint syndrome, which is more of a characteristic versus a trait genetically. And we need to do more clinical study, or we need to do more studies and research to figure out those differences.
Is there clinical trials? Are there clinical research efforts going on in multiple places? And are there actual clinical trials, or is the University of Illinois research preclinical? Can you give us an idea what the landscape looks like?
Unfortunately, I'm not knowledgeable enough with what the University of Illinois is doing right now with the Ehlers-Danlos Society. I'm hoping to become more knowledgeable, as it's just sort of seems like it's gotten a change going this year to move to University of Illinois. They were in Baltimore before that, I believe. But I'm very fascinated with what kind of research they're going to be doing, because they did in 2017, I believe they did a diagnostic reevaluation, and that was really when they took what was 6 types of EDS and decided they were really 12 types, and that we needed to differentiate people that had Ehlers-Danlos syndrome and people that just had joint hypermobility syndrome. And for example,
and are there clinical trials? I'm sorry for interrupting. I think there's a lag in our phone, so I may jump in a few times. Are there Ehlers-Danlos people who are cooperating now with the clinical research, and have you heard anything about that, or have any thoughts yourself about how you'd like to be, what you'd like to be asked, and what you needed?
I myself am in a clinical study for dysautonomia, which is a sister disease to Ehlers-Danlos syndrome. With Ehlers-Danlos syndrome, everything is stretchy. So imagine when I go from sitting to standing, usually a body would compensate and your veins would constrict, get tighter, your heart would beat differently to make up for that change in position so that you didn't faint and that blood got all the way to your head. In my case, because I'm so stretchy, the veins stretch, my blood pools in my legs, and I often faint standing up, which is why when you met me, I was in my electric wheelchair. I use that as a preventative measure because I would so often faint that those fainting injuries were more severe sometimes than just the injuries that I was having from just being an Ehlers-Danlos patient. And so that's been a big part of my
Ehlers-Danlos syndrome, is it Ehlers-Danlos syndrome, would you say it's an invisible disorder? Because you actually don't look like, and other people I've known that don't look like you have a serious disorder. You look great.
Oh, thank you. Yes, and that is sort of a common thing, a joke or running joke that we EDSers have, is that we're all fairly good looking and don't look like we're sick people necessarily. We're usually all very driven as well, very type A go-getter people. I've met a lot of similar people to myself in my support group here in Washington, and it's been quite amazing to see the work that just in this last decade, our group has gone from 25 people in 2011 to over 800 now in Washington State. And so that tells me I'm not sure if it's really a rare disease or is it rarely diagnosed, because it's an invisible disability and an invisible disease, truly.
And it's also a I have heard a pain syndrome. Can you talk about that?
That's right. So the instability of all of these joints, the ultimate symptom of that is going to be chronic, intractable pain, pain that will only get worse. And in my case, I've been lucky to be able to stabilize things and be consistently treated with pain. But I know many other patients with EDS in this state that have trouble seeking out pain treatment because we don't look sick, as you said, because we don't look necessarily like we're suffering. And I think that that's almost a harder leap to make because they don't understand the symptoms. People can't see the scars on my hips or my elbows or on my shoulders all the time. So it's really difficult to communicate all of my instabilities and weaknesses and have people really understand that or believe me. And so that's why it's such a gift to be able to do this advocacy, because I really want people to understand and believe that just like Sia and Lena Dunham have been more aware with their Ehlers-Danlos syndrome diagnosis, that we all should be more active in explaining our diagnoses. When a child looks at me in my wheelchair, I like to say hi. And if they want to ask why I'm in my wheelchair, I would love to explain it. I want there to be less of a stigma around disability and around especially invisible disabilities.
So how does being in a wheelchair your wheelchair is a very nice power chair, and I was admiring it because my son is in a very similar power chair. And he also, like you, he gets around and he's very active, but the power chair is really very necessary. And so how is it when you're having to live that way and you're traveling and so forth?
Gosh, my power chair is a gift. It was actually given to me from my late best friend's family. Kelly Seltzer Doyle was the first friend that I made in my EDS support group here in Washington. And she actually taught me how to be my own best advocate. I was a little too mouthy and polite and didn't want to ruffle feathers and wasn't really great at standing up for myself. And she really taught me how to stand up for myself and communicate issues and symptoms. And it was actually, she was on her way to the NIH for a clinical study when she unfortunately passed away untimely because of her Ehlers-Danlos symptoms and other symptoms overwhelming her. And so I inherited her chair, and it really has been quite a good luck charm to me. But I worry about it all the time. I worry about its safety traveling. I worry about, is it going to come out the plane the other end the same? A couple of times, Troy and I have had to wait an hour for it, and we wonder, is it there? Am I going to be able to walk out of here? I'm very lucky that my husband's so able-bodied and will carry me upstairs or give me a lot of mobility that maybe I wouldn't necessarily have. But I worry and wonder what patients who do not have that kind of support must do. And I think about that all the time, that I'm truly so blessed, and I wish that there was more that I could do. And so it's been great to have this advocacy tool to be able to hopefully help all of our patient population with connective tissue disease and EDS.
So you mentioned something that I just want to pause on it because it's so important to so many people in our society.
Mm-hmm.
And that is, and this happens to my son as well, when people with power chairs fly, the airlines frequently break them. And so when you get out the other end, it's often the case that your wheelchair does not get delivered to you, or it doesn't get delivered to you so you can use it. And then you could be out of that chair for days or weeks while the repairs happen. And those are your legs, right?
Exactly.
That's how you get around.
Yes.
And then you're trying to get around doing all this good work for people, and you're quite capable of doing it, yet they've taken away your legs because nobody has figured out a way for those poor airline employees to lift those heavy chairs.
Right. That's the other thing. I'm very lucky to have a chair that is, I think it's just over 100 pounds, but many are much heavier. And I know that that's been an issue with flying, and that mine is small enough of a chair where they're able to put it with other strollers, and I think it's easier to manipulate. But even so, I once had an incident coming back from DC where we weren't able to land at a gate. So everyone else walked down the stairs of the plane, and I went out the back with the food and the garbage and was terrified and crying and so upset that, I was bewildered because I didn't have anyone there. My dad was waiting for me at the gate, but they wouldn't let him come get me off the plane or help me in this situation. And I didn't feel very secure on that cart that lifted me down. And it certainly wasn't a fun situation. And the only compensation I was offered was maybe some points, to which my dad and I both said, no thanks. We just won't book with you again.
We've been in that situation so often. Yeah, I've seen my son drag himself on his stomach around the floor because at holiday time, because the airline had broken his chair, and it happens again and again and again. So when clinical research organizations, pharmaceutical companies are working with patient groups on clinical trials, some of them, the better ones who are more patient-focused, will provide transportation services and set up ramp vans and rides and so forth.
That's so important. It's so important, especially because I've noticed with these ride services like Uber and Lyft even, that there is no accountability to pick up disabled people. I've had it happen to me in DC where Ubers will see my wheelchair in the rain. The driver will literally slow down. I can see the car. It's the right car, but they keep driving. And there's no recourse for me other than to get another driver on the app to try to slow down and actually agree to stop and pick me up. But I understand that it's more work to pick me up, but I would also certainly tip somebody for helping me lift the wheelchair. But there needs to be more resources for people who are disabled to be able to use transportation and to be able to get to places just as easily as others. The fact that I have to count on my husband and mom so much for rides because I'm unable to drive myself has been a huge benefit, but I know so many people aren't able to do that, and that's why I have to bring a voice to this group of patients who really need more resources and help than they're being given. And often when they come looking for those resources and help are looked at with incredulous looks because they look fine on the outside. And I think it's just as important to recognize that disability runs on a spectrum of visible to invisible, and we have to acknowledge everything in between.
Yes, and you do so much for so many. It's just those things which to other people would be small if they could just provide
Yes.
the access to the buildings and the vehicles and the planes and let you do your thing, and
Yes.
then you make the big contribution to society that everybody wants to make.
Exactly. There are a lot of big things and then small things too. Like I complain about there's a movie rental service, Redbox, that has kiosks everywhere, but if you're in a wheelchair, you can't see the screen, so you can't rent a movie. And so I've been working with the Washington Civil Disability Group to try to see what we can do with that and hopefully just make little changes in society that'll make it more comfortable for disabled people to feel like we fit in and we're accepted, because it's hard.
Yes, that one with the red box you're talking about, the Little People of America that we've worked with often, they call that the reach issue, and they've advocated very successfully in past decades for making gas pumps somehow accessible, or at least the people will come out and gas up your car, the bank ATMs, and there's so many things. If you could just reach it, you could do it.
Exactly, and that's why I feel like it's so great that every patient with a rare disease or not rare disease really has that power in this country to be able to advocate for themselves. And everyone has this power to be able to go and speak to their representatives, to be able to go and speak at conferences. And I think that that's one of the blessings of our country. And I'm so glad and I'm so blessed and gifted that I'm able to speak for so many people whom I care so much for. Ehlers-Danlos Syndrome is so disabling, and it's truly such a painful disease. When you sublux or dislocate limbs, and life doesn't stop for that. I remember my biggest fear was not being able to walk down the aisle on my wedding day. So I had a lot of hip surgery to be able to do that. Looking back on it now, it seems scary because I love my wheelchair, and it's such a great tool to me. I would have loved to have used it that day, but at that time I hadn't been able to accept that identity yet, and just really wanted to traditionally walk down that aisle and make it not faint and look like a quote unquote normal bride. But what I learned was I'm a normal bride even now. If I went with my braces on or with my wheelchair or whatever it was, Troy was still going to marry me regardless. And so it really, it's been a really good lesson for me in learning to accept, it's hard when people stare at you sometimes in your wheelchair, but that's why it's so important I advocate, because this disease is so disabling. It is very painful, and we need to bring a voice to these patients because oftentimes they're so bedridden and they're in such pain that they're in survival mode. And when you're in survival mode, you aren't able to also advocate for yourself. That's asking too much. So certainly all rare disease people will go through bumps in the road where sometimes you are able to advocate more than others because of your health. But I think when we all have the opportunity to advocate, we should.
Yes, and upcoming soon is Rare Disease Week on Capitol Hill, which is at the end of February, and that's when a lot of us will come into the Hill, hundreds of rare disease advocates, and go in an organized fashion to speak to our legislators about many of these issues. And I know you're a big part of that. You have been an inspiration not only to me, but I know that you're an inspiration to many people in so many different areas. And it's important that you have used your voice the way you do and in so many ways, and show people that your identity is strong as a person with Ehlers-Danlos Syndrome. You're a wonderful young married couple that comes in together and proud of each other, and we're proud of you. And I think you make so many people feel better. So thank you for sharing that story with us today.
Thank you, Steve, and thank you likewise for this platform to speak and for doing the work that you are for clinical studies and to make them more efficient and better for patients. I truly appreciate that because the patient perspective is the most important. And I think sometimes that's forgotten. And I really value what you all do.
Great.
Thank you so much.
Thank you. Well, this is WCG Patient Radio. We've been speaking with Sarah Tompkins, the founder of the Ehlers-Danlos Syndrome Northwest, Ehlers-Danlos patient advocacy group in the Northwest. And the URL for that group, tell me if this is correct, Sarah, is edsnw.com. That's
right. The website is still being worked on, but you can follow us on social media.
Great, great. This is WCG Patient Radio. Thanks for listening, everybody. Goodbye.